No one here.
Good afternoon, everybody. My name is Bill Zolis. I'm with Penmore Benefits, and today, welcome to our 10th installment of our educational series. And today's is going to be presented by TELUS Health on virtual pharmacy. So we have a speaker today. It's our 10th again installment. I wanted to just explain that if anybody wanted to see this session again or give it to somebody else to watch, they are recorded and they're all on our website on penmore.com. So you can always go back to view them again. So again, the 10th session is about virtual pharmacies. And today we have Nisse, who leads the development effort at TELUS Health Virtual Pharmacy as the Senior Channel Sales Manager. Nisse works closely with brokers, advisors, and plan sponsors to help raise awareness on what makes virtual pharmacy a way to support a healthy and productive workplace or workforce while reducing benefit costs. Nisse has 20 years of cloud software and professional services experience within the human resource management and financial services industry. Previous to TELUS, Nisse managed strategic partnerships at Desjardins Employer Solutions and has also held various leadership roles at Ceridian, a global HR providers. So welcome, Nisse, and we're excited about what you have to present today.
Thank you, Bill. Thank you for the introduction. And like you've mentioned, hello, everyone. My name is Nisse Vaya. I work as the Channel Sales Manager at TELUS Health Virtual Pharmacy. I'd like to thank our partners at Penmore for the opportunity to speak with you today. A little bit of my background: I've spent much of my career working with HR leaders and the C-suite at finding ways to deliver greater services to your most important asset, which of course is your people. So today I'm here to raise awareness on the virtual pharmacy. And so what I'd like to do is guide us through the member experience, as well as some of the benefits. And I want to provide an overview of the value proposition so that we have a better understanding of how a virtual pharmacy can be leveraged to reduce your benefit costs. So as a level set, digital pharmacy services really allow your members to order prescriptions and have them delivered to your door free of charge. So they provide the ability to consult with a pharmacist that's convenient at a time for them. And it helps facilitate the access to medication information. And so, this also helps insurance providers and employers support the wellness of their employee while containing drug spend. If we look at some of the independent surveys conducted, for example, we have one here by Ledger that was conducted in September of last year. It found that about a third of Canadians have missed picking up their prescriptions. And so close to 60% have stated here that it's because it just slipped their mind. And half say it's due to work and family commitments. And about a quarter of Canadians, 25%, are not even aware that virtual pharmacy services even exist. When we look at the claim volumes coming from major online pharmacy providers, we see a continued growth throughout the pandemic. And so the trending we've seen over a 3-year period saw an overall growth of about 500% in claim volumes from the major online pharmacy providers across Canada. And so a little snippet here, if we compare that to what we've seen in the retail pharmacy growth in that same period, it was estimated to be around 10 to 15%. So it's quite substantial in terms of the comparisons. So why consider a digital pharmacy altogether? Perhaps you or a family member, first of all, take maintenance meds that you refill regularly. Or you've developed new habits. I know I have, of using virtual healthcare options, especially during the circumstances that we're in. And maybe the employer benefits plans offer some kind of coverage incentive, like lower copays, for example. Or you're just looking for a more convenient way to interact with the pharmacy. So I'm happy to share that TELUS Health Virtual Pharmacy was brought to market to serve the growing trends that we're seeing in Canada. So we launched in October of last year. And, by the way, you can visit us at teluspharmacy.com, where you can see our new portal and our new mobile app. And it's refreshed. It's an experience to help patients that may actually already be on the platform and get more out of their medications. So something to keep in mind is that we're moving away, and it's less about the transactional element of mail order pharmacy. And we're really starting to infuse the TELUS brand and feel, which is a more intuitive user experience and a more intuitive user interface that allows patients to really take control of their medication and really empowers them to take control of their health. So just as a level set, TELUS Health acquired Alliance Pharmacy Group in February of last year. So Alliance was a pharmacy with a near national footprint, so outside of Quebec, with a real history of sharing medication in a mail order fashion, coast to coast. So we saw this as an interesting asset to the TELUS Health ecosystem, because we could take that foundation, which we have in Alliance, which was the expertise in the form of its automation, its capacity, its knowledge on how to distribute, along with the TELUS Health assets and the digital capabilities, and really turn it into something that's a little bit more future facing. So in doing so, we bring this expertise in the commitment to health. And this is from a broader ecosystem. And this is where we're headed into the future, which is where it's really where we're taking our roadmap. So this helps support things like our PBM and our health benefit management initiatives, our electronic medical records or our EMR initiatives. And in the future, we look to integrate this in regards to our virtual pharmacy with our virtual care offering, which will really take that foundation and again, turn it into something that's future facing. What I also wanted to briefly share is our current services. So we have 3 pharmacies, one in British Columbia, one in Manitoba, and one in Ontario, serving 9 provinces and 3 territories. And we're expanding to Quebec and Alberta and New Brunswick this year. And this will give us a complete national presence. And let's make no bones about it, we're a full service pharmacy. So we saw a lot of growth last year, being able to provide like acute maintenance and specialty meds to all patients. Some of the other things that we offer as a standard comprehensive package that we include is things like 90-day or next day business delivery at no extra charge. So that's covered by us. And the 90-day fill rates. Not only does that improve efficiencies for us, but most importantly, it helps reduce dispense fees for the patient and plan sponsors. From an adherence point of view, we offer our med packs to people that perhaps have challenges remembering and organizing their medications. And then we also have this layer of where we can add automation and skill capabilities to really scale up our growth. And so this is the underpinning for our preferred provider network offerings that we can provide to our partners like Penmore that allow for cost savings and reduced dispense fees. So these are actual images of a product suite as well as a pharmacy team. So this will give you an idea of the look and feel of everything. So on the left here, you see some vials, and right beside it is our med pack. So this is unique to TELUS, but this is our med pack for adherence, which by the way are also eco-friendly in terms of its packaging. And in this case, what you also see is our mobile app. And then just to the right here is our team of actual pharmacists. In this case, they're actually based out of our Aurora facility. And that's our actual staff that help provide quality care day in and day out.
Nisse, one thing about the med pack, those are very convenient, but you should also mention that patients can also mention to add their supplements to that. So instead of just your prescription medications, you can have your vitamin C's, vitamin D's, omega-3, 6, 9s, whatever supplements that they're currently taking, they can be added into that same package. So if people are going away on vacation, they can strip off the 7 days and they have everything in one little strip.
Absolutely. Thank you for that, Gianluca. So who uses virtual pharmacy services? And it's people like Suzanne, who are like myself and many others, a part of this sandwich generation, which are not only looking to look after their own medications, and maybe they have children as well, but they're looking after their own medications, but are increasingly concerned about their loved ones. And so Suzanne wants to have a better understanding of their meds, of the meds, like, for example, here, the meds that her dad's taking, but also wants to make sure that he's actually taking them, and is looking for a solution to better manage in a way that works for both of them, both her and her father. So what we see here, this gives an overview of what a patient journey in the mobile app can look like. By the way, for TELUS Health Virtual Pharmacy, our app's available in the App Store and Google Play. But this really takes the mail order experience and centralizes it in a really intuitive fashion. So going briefly here, left to right, what you see here is the ability to create an account. And then as you go on building your profile, there's the ability to tell about your medical conditions if you have any. It could be diabetes or asthma or a heart condition. And then you put in do you have any type of allergies and those sorts of things. And then what's next is if you have medications elsewhere and you'd like to transfer them in, and tell us about it. Where are they? What pharmacy are they at? Are you going to transfer some or all of them? And do we want to fill them right now or wait at a later point in time? So again, really turning this into very much a self-serve, easy access experience. Then the feature I alluded to here is the ability to add a family member with their consent, of course, because many seniors today, for example, may not be as technologically savvy, but perhaps some of their family members, like myself or Suzanne, might be a little more so. And so there's this opportunity for, quite frankly, peace of mind, because previous to this, seniors had their medications, they had them in their wallet or in their purse, and which is okay, which is just fine, but only they had access to it. So now Suzanne has a better control and is able to help her dad in his care. And we think this family member function is actually a real differentiator in the market. Then there's the actual screen about your order. So, we have the image here of the medication and what kind of workflow there is, as well as letting you know, like, when is your medication going to get shipped out. And by the way, with TELUS, we'll even call the doctor for renewals. And the final piece here is where we really take the care element to build trust. You have the ability to speak to your pharmacist. You can do that, via call, via virtual face-to-face. And that actually offers a lot of convenience to allow patients to take the time to learn about their medications. Because very often, when you go to the pharmacy, here's the experience that I've experienced. Very often when you're going to the pharmacy, you may not be in the right frame of mind to receive the information that you're being shared. So, you've really had a long day. You've waited a couple of hours in the doctor's office. I'm having pay issues, and I just want to get home. And so taking in what the pharmacist is telling you about the therapy is difficult. So this is a great way both to empower people to connect at a time that's convenient for them, but it also helps build trust in the process that is virtual pharmacy.
And Nisse, I just wanted to add that another good part is the privacy aspect. I mean, I know in pharmacies, they're lined up, they're busy. You may be, they tell you stand behind the red line, but people are pretty loud. You can hear exactly what they're talking about as much as, and you never know. It could be a neighborhood pharmacy where it's your neighbor there.
Absolutely.
And, there's no privacy. And plus, like you've already alluded to, with the pharmacist at TELUS, you can book a time, like an appointment. So it's just one-on-one. And I think it's much calmer that way. The other way, even the pharmacist is, going crazy too behind the counter, doing a whole bunch of things at once. And I just find it's more just, calm, because like you said, it could be bad news, or, you're, like you said, you're from a doctor's office in pain and waiting to get this medication. And I've heard some pharmacists say, yeah, just drink with water and, and food. Yes. And then walk away like so fast that, God forbid, like even if English was your first language, very difficult to understand what they said. I couldn't imagine a senior, or if English was your second language, you probably have no clue what they just said. And you just go home and kind of guess, or hopefully read the vial is all you can do.
Yes. And so, a couple of things that we say here is never wait in line again, and no more awkward conversations in public.
Mm-hmm.
So the idea of enhancing the member care experience, this is the core of what's being offered through a virtual pharmacy. It's about taking that foundation, again, of that mail order experience and infusing it with health technology assets to really bring the best of both from a capabilities and expertise perspective, so that we can really actually begin to act as a therapeutic care guide. And in doing so, we're helping plan members live their healthiest lives. And we're going to use the virtual pharmacy as a compelling lever to help reduce costs for plan sponsors and plan members. So virtual pharmacy provides employers with an affordable solution that delivers like a convenient and personalized pharmacy service to their members. So this really meets them on their terms. And we saw this through COVID, right? Where people got used to the idea and the convenience of receiving some of their health therapy increasingly through virtual means. And, we're seeing this right across our lives right now, this on-demand effect of everything being available at your fingertips. So a digital pharmacy experience helps reduce things like absenteeism by improving a member's medication adherence, leading to better healthcare outcomes, and empowers the member with better pharmacare access and support. And so this is cutting edge healthcare technology that you can offer to and leverage to use to attract top talent, retain and attract top talent. And now we have the means to help deliver this experience in a way that helps reduce the cost of care. Now, for plan members, we feel that if you're going to be in the virtual pharmacy business, an easy on-demand experience and therapies that work for people, that's a prerequisite. So, however, if we go beyond that, having a fulsome view of one's medication and minimizing the risk of things like negative interactions helps support optimization and the value promised by therapies. So virtual pharmacies provide the ability to guide the member through a more personalized experience, including coverage options and benefits and trade-offs, and also enable the pharmacist to engage with patients. And so what it does here is it creates like a meaningful interaction. And in doing so, we really start to customize the level of care. So what you see here are the various levers to consider when evaluating if a virtual pharmacy can provide meaningful savings. So the first is the dispense fee, which for TELUS, our preferred pharmacy network, our PPN pricing, should be pretty standard across all carriers or in the ballpark. And our virtual pharmacy pricing with a PPN would include a dispense fee of $6.49. That should realize a savings of approximately about 50% versus the retail consumer dispensing fee. So you can talk to your advisor at Penmore for more details. So this represents a meaningful savings right off the bat. It's highly visible. Patients can see that, they can shop it, and it's lower than most prices out there. There's other examples, but that may be loss leaders, but you're kind of going into those situations and probably spending $200-300 on household items. On the markup, we go down a few percentage points. We go down 3% on brand medications and keep it even for generic. And the reasons we say this is because we want something in it for both the member and the plan sponsor. Because brand makes about 60 to 70% of drug spend, with generic making about 20%. So it's a smaller amount. So again, we want meaningful change for plan sponsor and plan member. So the percentage discount on brand, which makes up the larger spend, starts to add up. It really does over on paper, and it adds up even more when you start to go across different provinces, in particular when you look at a situation like British Columbia. And finally, maximizing savings through a 90-day supply. We actually think it's better to ship longer day supply, because not only does this saves us on our end, but again, it saves plan members and plan sponsors dispensing fees versus the corner pharmacy, where, of course, every time you're going in there, there's a chance to pick up milk or, cosmetics, or you're buying something else. And that's not the kind of play that we're looking for. So what we see, the way we see it, is longer fill times creates real value.
Anisha, I just want to bring up a couple of points. You're correct in saying that the $6.49 dispensing fee, talk to any one of us, at Penmore to have more details on that. You will get that if you have a certain plan design. It's not necessary. Like if you do not have a certain plan design, you may not get that. So just talk to us about that. And I wanted to make one big point, therapeutic alternatives. So let's say there's a brand name drug out there where there's no generic yet for that brand name drug. The pharmacist is educated where, they obviously, I think they know personally more than your family doctor to talk. They can't make changes without talking to your doctor, but they will talk to your doctor and ask them, can you try one of these? Have you tried one of these? Here's a suggestion of a medication. It's not just the cost. A lot of times it's the same ingredients. It'll do the same job, as opposed to going right away just to the brand. So I think it's important to know that the pharmacists are trained at TELUS to have that discussion. And I think my understanding is a lot of times they will talk to the patient first and ask them, do you mind if I talk to your doctor about this? And I think that's so important. I find the bricks and mortar places, not as much. I'm not here to put them down, but they just don't. And there's a huge cost and difference. And if it can do, the first thing is your health. If it can take care of you the same way, because most layman people, I wouldn't know. It's whatever the doctor tells you, you just do it.
Right.
And I think that's really important role of a pharmacist.
Absolutely. So just to finish up here, a couple of things I wanted to share with you here is that when we set out, we wanted to do 3 elements. You see them here on the left. We want to create like a meaningful lever to help bend the cost curve. And we wanted to help create flexibility of coverage for a changing workforce. And we want to enhance the member care experience. And that's kind of the areas we really wanted to do well. And so it was interesting in our journey, right? One of the things that we did is a part of the process where we actually sought out opinions and feedback from our TELUS employee base. So, we have about 35,000 employees here at TELUS. And so we sent out a survey to about 6,000 employees. And we heard back from several thousand. And in fact, we heard back from about 1,400 in less than a week. And the questions we asked were, if we were to add this as a part of our benefit plan, what would be some of the things that we would need to do really well for you to be interested enough to actually take advantage of the service? And so we heard back. And there has been, one of the things was that there has to be a cost savings that comes through the markups and dispensing fees and a tangible cost benefit to the TELUS team member. The other things that we learned loud and clear was that the quality of service has to be solid. And we have to do this really well. And from a convenience perspective, even when we're receiving the package to the video consultation with the pharmacist, it has to be something that we're proud of. And that final piece is the ease of use. How easy is it to use these things? So we had 500 volunteers at TELUS test this out and give like scheduled feedback. And we heard the feedback, good, bad, and otherwise. And this is our commitment to the market. We have a solution that is effective for all, and that our own TELUS community are invested in seeing better healthcare outcomes for Canadians. So I hope I've brought a better understanding around the virtual pharmacy. At TELUS Health, we're really excited about our unique ability to provide a fulsome offering like no other and help Canadians live their healthiest lives. Thank you. Now, I'm happy to answer any questions that there may come from the floor. I'm really happy to be joined by my colleague, Nilisha Patel. So she is our account manager who manages some of the day-to-day activities with our partners. And so if there's any questions, feel free to bring them forward.
Yeah, you can put them in the question and answers or the chat. But Nisse, I wanted to bring up one, I don't know what the machines are called because I'm certainly not in the business, but I remember a long time ago being told that the maintenance drugs are dispensed by machinery that's very accurate. And when you compare it to a human element of counting, you're human. I mean, the phone rings, I don't know, you lost count, you're not having a good day. But the machine's accuracy are amazing. I don't know, Nilisha or Nisse, can you comment on that?
Yeah, they're called Script Pros for the actual vials that we use, and we use the PackMed for our med packs. So it all sounds a little the same, but the med pack is fantastic. I know we've got a lot of people using that, and whether you're having issues with compliancy or not, I know I personally am on the med pack and I really enjoy it. So like Gianluca already stated, you can have your OTCs in there. So I have my daily vitamins, and it's split out into 2 times a day that I take it, but it can certainly be split out into 10 times a day, 12 times a day, however often you take your medications. But the best part for me is I could just tear off a couple of strips if I have a meeting for the day, or I'm out and about, or however, a few days at a time. And it's just super, super convenient. We do all the legwork for you. So it's just really easy for you to continue to take your medication at the right time every time.
That's great. You know what, Delisha, can you go to right from scratch? I go to my doctor's office. What do I do? Like, how does it work?
Yeah, so that's a great question, Bill. So when you go to your doctor's office, the doctor is going to give you a prescription. Either he's going to print it and give it to you, but most likely he's faxing it right to your pharmacy. All you need to do is give the doctor our pharmacy phone and fax number, and he can send it directly. And I know fax sounds so archaic, but that's what we still use technologically. It's still a fax. So our numbers are right on our website, very easy to see, and you just do it based on your province. So if, many of you companies are national, you're just located here in Ontario, but our numbers are right on our website, and easy to just provide right there. And once you download your app, so we do encourage everyone to use our web app now for registration. One of the nicest things about this web app is that you can control everything. You can control the number of people that you are, viewing accounts on. They can give you access if they're over the age of 18. You can manage your refills. You can ask us to call the doctor for renewals if you want us to do that. If you're out of refills, you can change your credit card. You can pay with credit card or any other electronic method through our website. And you can completely discontinue any credit card all on your own. So you don't have to wait for us to do any of those things. And you can also add multiple addresses if you like. Say today you want it shipped to the office because you're working in the office, but next week you're working from home. We're happy to ship it to home, cottage, wherever you like. And pretty much as soon as we get that prescription, we're going to give you a call if we have any questions. If it's really straightforward and the doctor says fill it right away, we're going to fill it right away and ship it to you. But usually we'll want you to advise us if there is counseling required, because if it is a new prescription for you, our pharmacists are going to want to go over that with you to ensure that you're using it correctly. If you have any questions, if there are any interactions you should be aware of, and that sort of thing. And then payment delivery, simple, and delivery, we use next business day is our goal in every case. Of course, some remote locations may require a day or two, but next business day is what we like to promote at all times. Thanks.
I have one question. Often there's throughout our lifetime, some people might already be at that stage where you're managing your medications for your parents, elderly parents, grandparents, etc. Is that
Yes.
something that can be managed in the TELUS app? So you can have multiple
Absolutely.
people. I can have mom and grandma and aunt and uncle, etc.
Absolutely. And that's one of the biggest things that, many of you have known us as Alliance before, but now we are TELUS. And with that TELUS engine comes beautiful enhancements to our web app. So you can absolutely add your parents as a caregiver. And, at our end, we have verifications in place. So privacy, confidentiality, all of those things are embedded into our web app. And you can do that directly through the app, see where their medications are, see how they, what needs renewals, what you want us to do, if you want to schedule a doctor's appointment, that sort of thing. So it'll help you walk through all of those things. Great
Wonderful.
question, Gianluca.
Yeah, and I just want to repeat, I know it's been answered, Gianluca, thank you for answering the question about this is recorded right now, and yes, it will be on our Penmore website, which is penmore.com. So if you want to review it later or have somebody else look at it, please do. So it will be there. I don't know, are there any questions, from the folks listening? I do know that from my experience with our clients, and I'm not just saying this, I really have not had any issues come back, but I think the hardest part for Canadians in general is changing behavior. That is a difficult challenge. I know in the US, this type of service is huge. I mean, they're a bigger market than we are, but if anybody just even tries it, they'll get so used to it that they'll say, why do I need to go back constantly to the bricks and mortar place where it just comes to me when I need it and refill, especially a maintenance drug. I mean, mainly when you're going to have most likely those meds for the rest of your life. It's just so convenient. And I do believe that one-on-one with the pharmacist is just leaps and bounds ahead of what's out there now with the bricks and mortar place. So those are just, in just trying it. I mean, it's hard for people because I know they develop a relationship maybe with a certain pharmacy and it's convenient, it's there. But when they really, I know most people do not know. I've had people say they think the cost of medications are just the same everywhere. It's regulated somehow. And no, it's not. But they don't know that, right? How would they know that? They just think it is what it is. No, that it isn't. As a matter of fact, my understanding is you can phone different pharmacies and give them the drug identification number and the amount you need and ask them what it costs. And most will tell you. And you will see, their marketing makeup is so different. And they have that huge overhead at the bricks and mortar place, which the virtual people don't have as much. So it's going back to you. I mean, partly, right? So, I'm not sure. Is there anything else you wanted to add, Alicia?
Well,
that you
Bill adds a big point that, with the local pharmacist, you have a one-on-one. So now with our virtual pharmacy visits, you can actually see our pharmacists and speak to them one-on-one. And that's a super fantastic feature, especially as we've known with COVID this past couple of years, 2 years. Oh my gosh. It's become a benefit to have that ability to speak to your pharmacist directly online. And, that's one of the great things with technology is that we are able to provide you that bricks and mortar service without, all the hassle of bricks and mortar. And again, that privacy is very, very important, like Bill has said as well. So great.
Sure. And again, I'm not going to pick on anybody, but why they make you wait for your medications. They could be busy, but part of their marketing is so you buy other stuff there.
That's right.
I mean, face it, it's part of their marketing. And, you buy shampoo and I don't know, chocolate milk and a lottery ticket and a book while you're waiting. And they love you to do that because that's part of their marketing. And in this case, you're just getting what you need. You know what I mean? And this is your main reason for, using like TELUS. So, and I don't know if you want to just give a quick explanation about the exciting things that are happening at TELUS, a couple of minutes there, Nisse. I know, that the future is a kind of one-stop shopping for many things, including the virtual healthcare, right? And want to take a minute because we have some time to maybe quickly say something about that.
Yeah, so that's a really good point, Bill. So one of the things that we are looking to see in 2022, probably in the latter half, is an integration between our virtual care offering our virtual care app and the virtual pharmacy app. So now we'll really have, a broader spectrum in terms of the continuity of care, right from the point where your interaction with your doctor to all the way through to the pharmacy and medication fulfillment, right? So that is a holistic offering that no other provider is really going to be able to match in the country. So we're really, really excited about that.
Yeah, no, thank you. I mean, that's definitely the way. So looks like we ended up quickly. I don't see any more questions, but feel free to reach any one of us, Gianluca, myself, if you have any questions down the road, and we will take this. And thank you very much, Nisse and Nilisha. You did a great job, and I hope this opened the door. I know some people were on the line that are already using TELUS, but then maybe refresh them a little bit, or new folks that have never even thought of using them. But I know most of the people that I have aboard using this, I hear nothing but great things. I mean, and that's what we want to hear, because as advisors, we want to make sure we partner our our clients with good partnerships. Otherwise we'd never do it. But it's been a long-term relationship with Alliance Pharmacy and now TELUS, and I hope it goes forward just as well. And if not, I'm sure there's going to be new things constantly happening go forward, because this was a big announcement for sure. And I know the technology that TELUS has go forward is going to be next to, that's going to be key, and it's a changing world constantly, right?
Absolutely. And this, there's a lot more that we're really excited about, as we go into the years beyond, because if we really talk about the expanded ecosystem that TELUS is building in terms of its healthcare assets, it's really exciting, right? Because it really plays a fulsome approach to the patient journey all the way through the Canadian healthcare system.
Yeah, it's funny. There's this joke that went around for those of you, I'm aging myself, that watch the Jetsons. It literally had a big screen with the doctor on there, and they, I think the Jetsons were in the 60s, and they said, man, virtual healthcare was actually, people probably laughed at it back then. And you look at it now where it's just like second nature, or will become that, right?
Absolutely. And I think you had alluded to this, Bill, but when we look at our counterparts in the US, there is a general mentality that is there is usually a higher adoption when it comes to technology in general. And so, the analogy we sometimes use is that our American, counterparts will kind of say, yeah, we'll take an order of X amount and we're going to try it out right away. Send us a couple of shipping tanks. And in the Canadian mentality, sometimes it's, okay, can you send us some samples, if you will? And so when it comes to technology, we have seen a little bit of a trend where Canadians are a little bit more conservative. But as we alluded to in our messaging today, the data kind of shows where the growth is in terms of virtual pharmacy, and we only expect this to amplify in the years to come.
Right. Okay. Well, listen, for those of you in Ontario, we have a Family Day weekend, so I hope everybody enjoys that. And otherwise, again, thank you, Nilisha and Nisse. I really appreciate your time and information. I think we made it simple enough for people to see it, but come back with questions, after you view it again, because that's what we do every day. People like Gianluca and I. So please come back if you want to know how to start this, and relay it simply to your employees, because that's a key too, is how do you communicate this to everybody so they understand it, right? So that's all right. Thank you.
Thanks for having
Have
us.
a good weekend,
Thank you for
everybody.
having us.
Thank you very
Take care.
much.
Okay, bye-bye.
Bye now.